Good evening, Child Care Profit Strategy community. It's me, Shanita Jones, your Child Care CPA, your Child Care Profit Strategist. Now, I know you're used to hearing me talk about taxes and money and IRS and payroll and all of those things. But as you all know, there's a lot more that comes along with the child care business that has nothing to do with money. It's the actual child in the child care. And something that is near and dear to my heart, our children. And some of our children are going through things that we couldn't even imagine going through. They have experienced some things that we have not seen, some things that we probably never want to see. And that leaves them with trauma. And we don't always know why a child is behaving the way they're behaving, why families act the way they act, or even why some of our staff behave the way that they behave from some things that went on in their childhood. Well, I was talking to a great friend of mine, a licensed therapist, soon to be a PhD. She said I'm not allowed to call her Dr. Dawn yet. So when I'm able to, I will. So I want to give her a proper introduction. Miss Dawn, she doesn't like it when I call her that either. Miss Dawn is the owner of Tranquil Solutions for a Centered Mind, which offers private therapy services. Miss Dawn, I'm going to find your actual real bio that I'm reading here because we had so many.
Okay.
And I might have to start that over and do it properly. Lord Jesus, that's okay. Thank God for the edit. Okay, here we go. Doing that's Paramore. She has a lot of credentials. I'm trying to get them all right. LPCMH, CAADC, ABD. Like me, she's a Philadelphia native, a licensed mental health professional. She's pursuing her doctorate in prevention science from Wilmington University, another one of my alma maters. And she's receiving a master's degree in community counseling. Dawn has received several certifications specializing in trauma, informed care, and substance abuse, as well as treating children, adolescents, adults, couples, and families. Licenses and certifications include licensed professional counselor of mental health, certified advanced alcohol and drug counselor. She's on a national board of certified counselors, trauma-focused cognitive behavioral therapy. Dawn is also, when she's not doing all that, she's also the CEO of Tranquil Solutions for a Centered Mind, Camp Bliss Kids, and Total Renewal Wellness Center. She is also the Division of Prevention and Behavioral Health Services, Symptoms of Care Implementation and Expansion for the state of Delaware. Dawn works with her canine companion, a certified therapy dog with Paws for People and Canine. He's also a canine good citizen. That's Mr. Duke Ellington of Delaware, and he is a handsome, trained golden doodle. So I stumbled through all that. That's a lot of good stuff. Forgive me, but I'm going to be quiet and allow you to go ahead and take the floor and share what you have for us today.
So thank you so much, Nita. Hopefully you can hear me. I'm still experiencing some sound where it's going in and out. So let me know, thumbs up if you can hear me. Awesome, awesome. So I am so excited to be with you tonight and to share with everyone that you know in regards to trauma in children. That is definitely near and dear to my heart. So I'm going to go ahead and share my screen. All right. All right, everyone. So again, my name is Dawn Paramore, and I am employed with my company, Tranquil Solutions for a Centered Mind. So let's talk about like what happened and how I got into this field. It was actually trauma that brought me to this field. I was working as a paralegal in some offices in Wilmington, Delaware, and in the midst of all that, I lost a child. Um, it was stillbirth, and at the time I needed a therapist and could not find one. Actually, when I called, I would get people saying, well, we have a waiting list of 3 weeks, but I was not okay. That's an understatement. So what I did was I found a therapist, and I was thinking, like, this is crazy. Like, people should not have to wait to get services when they need them right away, especially when they're experiencing trauma. So I was like, I can do this. And I went right back to school and I got my master's in community health. And that's here I am now, and gotten a couple of certifications later. So all this stuff, she did a really good job with reading it. So these are just all my certifications. So what am I going to do now, just so you can understand exactly what it is that we are going to be talking about? I'm going to have Shanita play like a 4-minute video, and then I will continue.
My heart broke for her. She looked so. I wanted to take her pain away.
All the kids involved were so overwhelmed. We just tried to make them feel safe.
I felt helpless. Like there was so much more I should be doing something better for him, but I couldn't find the right words.
I struggled with my own fear and trauma after the hurricane. But I needed to find a way to help my kids deal with their feelings too.
These are the voices of adults who are close to children in the aftermath of a traumatic event. They might be parents, family members, teachers, clergy, first responders, medical personnel, humanitarian workers, or concerned volunteers. During those critical first hours and days after the trauma, adult presence and support is especially important for children. Any adult can make a difference for a child who has suffered a traumatic experience, regardless of the type of event. Keep a few important tips in mind. Provide safety. This is the most important tip of all. The feeling of safety after trauma is paramount, especially for children. Trauma survivors often describe feeling fear and vulnerability. Any small gesture of safety goes a long way. Talk with the child. Help the child understand, if possible, what happened in the event. Stick with the facts. There is no need to ask a child to discuss his or her own experience. Available and ready if it is helpful. This allows him or her to make sense of emotional reactions such as hold the child. If appropriate, human touch can be very beneficial for children who are afraid and in the aftermath of a frightening experience, which from a trusted adult or someone trying to help can be a big part of making a child feel secure. Never force this, as it can be unwanted. Making yourself available is an act of protection, safety, and love. Relax the rules but maintain structure. It is okay to allow for some changes to rigid rules in an attempt to show the child you understand the magnitude of what happened. However, children respond well to a series to remain the same, especially when things around them seem to be changing or uncertain. For example, young people can be excused from school immediately following an event. Soon after, however, they may find comfort in the structure offered by school, even if classes are modified in order to discuss. Help others. Giving your time and energy to others who may have also experienced trauma is helpful for everyone involved. It helps those who need you, empowers you to feel like you are actively committed to others, and provides a good role model of service and giving for children who might be looking for an example. People who share a traumatic experience can also experience the strength and hope of others. Trauma is difficult for everyone. There is no single right response after a traumatic event. Recovery is a process and requires understanding from others and time for healing. However, everyone needs to feel safe and cared for, especially children. Knowledge of a few important tips can arm you with strength that you can share with children who might be especially frightened and vulnerable in the aftermath of trauma. It allows you to, and with that help comes hope.
Okay, so I saw a few people in the chat and you were saying you couldn't hear it. So what I'm going to make sure that I do before we end, I'm going to provide the link in the chat so that you can kind of go back at your own leisure and listen to what it was saying. So we're going to go over a few things now. I'm going to go back and share my screen. Okay. So these are some things that you want to take a look at if you notice any children in your daycare, not just for children in a daycare setting, but this applies to even children in your household. So if there's a change in routine, like if you have a family and they're going through a divorce or a separation and this, mom or dad has moved out of the household, that change of routine, believe it or not, can actually cause a stress for a child, especially a young child that can't really talk about, what they're feeling. And you have to understand too, children, they don't have the same ability that we do to express how we feel. If I'm upset about something, I can say, I don't like this, I'm upset with this. But my 2-year-old son, for example, he has some challenges. He actually works with a speech and language pathologist. So he can't tell me. So I have to, he says some words, but I have to look at what he does that's different. If I notice what his baseline behaviors are and he's doing something that's different, there's likely that he is experiencing some kind of stress. And it doesn't always have to be trauma, but stress alone for children can manifest this way as well. So can family issues. So you want to make sure that you have a conversation with your parents, and just, if something changes in your household, let us know. The only doctor that I know that can actually treat patients without saying anything is a veterinarian. So therefore, you have to talk to us. You got to let us know what's going on. Your parents should be encouraged to do the same thing. So if something changed, not that you're trying to get into their family business, but it's going to help you provide a really good, solid service for your children. You want to make sure that the families are talking to you. Same thing with academics. Some of you have children that are riding the bus and they drop off and they pick up at your facility. So if there's things going on at school, they could have been fine in the morning, but they get to your facility and then, there's all hell breaks out. So you want to look at all these things: bullying, desire to be accepted. And a lot of our kids identify as transgender, gay, lesbian, bisexual. So if they're going through these changes or of sexuality, that can also be a stressor, especially if they're being bullied. So you want to just kind of take a look at those things. But exposure to trauma pretty much looks like violence or sexual abuse or even physical abuse. There is a screener that I provide children that I do work with. I'm certified in trauma-focused cognitive behavioral therapy, short for TFCBT. And basically we go through what we call a UCLA, just kind of like the school, University of California, Los Angeles. And they came up with this tool that we as clinicians will use, that are certified to use this tool, to determine if a child meets the standards for a post-traumatic stress disorder. And on there, it'll ask you questions, not just about violence, sexual abuse, or even physical abuse. They will start asking you things like, have you been in a hurricane? Have you seen a shooting? Have you seen a body outside of a funeral home? Things of that nature. Because believe it or not, these are things that are stressful to children. And we want to make sure that those things are not ignored. The other thing is, how do you manage the stress? Now, you could not hear the video, but I'm going to make sure that you have copies of the link so that you can watch it at your own leisure. But in the daycare setting, you definitely have to watch your tone, because all this, sometimes it's like, I can't hear what you're saying because you're speaking so loud, or or your emotions are coming through so loud. So if you watch my face, it's kind of like this. You think you might have a peaceful and a jovial tone, but it could come across like this. Do you like the ice cream? Yes. Yes, I love the ice cream. So what is the child hearing? That's confusing. You know, your tone is everything. You might say things, you think you're saying them in a nice way, like, I like your shirt, but if you're saying it like this, what do you think your child's going to hear? The child's going to hear you speaking in a way that's, you know, scary to them. And also, use of stress balls are nice. It's for children that obviously can't put them in their mouth because it helps to push stress away from them and actually put it in a different area. My son uses this thing, he calls it bubble pop. It's a little kind of rubbery thing that he pops and it helps him with stress. Conflict resolution. This is huge. Our children are watching us. We have to be the biggest example of what it is to resolve conflict. So watch when two kids are arguing over a toy example, for example, watch how you do conflict resolution because you're teaching them how to resolve things that doesn't result in trauma. And overall support. So just being there for the child. The video mentioned hugging the child, having a soft tone, like listening to the child, so forth and so on. In the home, you want to tell your parents the same thing. Watch your tone. It's not do as I say and not as I do. You can't say one thing with this horrible voice and then expect the child to respond to that. Some kids will because they're resilient, but some kids will not. Also, acknowledge at home, but tell your parents you don't have all the answers, and that's okay. I had to learn that. I'm a single mom. I don't have all the answers, but it's okay to say that. But what I can tell my child when he's old enough to understand is that I don't have the answers, but I'm going to try to get them, and together we'll work together. And when you're ready to talk, then I'm here to talk. And if you want someone to talk to, then I'm here to provide that service as well. Recognize the change in behavior. So my son, I can't really say he's not verbal because he, like I said, he said some words, but if his behavior changed, like for example, a week ago, he was involved in something very horrific at a daycare that I will not mention. And one of the behaviors, because he doesn't really talk, is that he ran to the couch and went into a fetal position. That's not usual for him. So I was just thinking, that's kind of odd, but maybe he's hungry. You want to look at all those different changes. If they start playing rough, if they start pinching or biting other kids, all of a sudden they're getting to fights at school. They're picking fights with people at the daycare, the other kids at the daycare. Those are signs that there could be something that may not be right. And they can't say, I'm upset about this. Remember, they're kids. And here's the thing, for those at home, get to know your children's friends. I know this, like, wait a minute, I am my age and I don't feel like talking to kids. That's not my thing. You want to get to know their friends. When Christopher is old enough, you better believe I'm going to have him at my house, full-blown pizza parties. I want to know who they're hanging with. And the best way to do that is in a situation like that. And listen to their music and don't be so quick to criticize what they're listening to, because some of the music that they're listening to, sometimes they're trying to tell you something, or a song can kind of like say how they're feeling in a way that they just can't. So you want to make sure that you are able to do that and not cut them off. When I work with kids, specifically teens, we do listen to music. And sometimes the parents will get very upset, like, why did you let them listen to that? Because I want to know what they're feeling. And sometimes they may not know how to communicate that. So I need to know what you're listening to. And we pick apart words and figure out what that all means. So I work with a certified therapy dog. I'm kind of blessed. His name is Duke Ellington of Delaware. And you see he is a CGC, which means Canine Good Citizen. We work in several places. This is AI DuPont Middle School. And we've worked at Skyline Middle School. We've been to Terry Center, couple different places. Primarily with the trauma work that I do, he works with me in my practice. So you can see, I think this is Bayard Middle School to the far left. And in the middle is AI DuPont. And then this is Officer Peony. She is a Delaware State Trooper at she was at Skyline Middle School, but the presence of a therapy dog is great. And you're saying, well, how do I get that in my building? I'm so glad you were thinking that. I don't know that because I can't hear you say it. But there's an organization that Duke works with, and it's called Paws for People. And they actually, if you call them, they're a nonprofit organization, and they like to bring the support of an animal. They work with rabbits and dogs, believe it or not, and cats, I believe. But they work with the community. And what you can do is call Paws for People and say, you know what, I think I want to have a support animal come into the building. One great thing about Paws for People, it's not just about petting the dog. So for example, my dog is certified in breeding. So we would lay a blanket down, the child would get on the blanket, and they would read to the dog. that is a great thing. Just recently in December, Duke and I visited Bayard Middle School, and I did not know, unbeknownst to me, we all know that stuff goes on in Wilmington, right? But that particular day, I did not know that it was something that went on that night. So the kids were responding, but I didn't know. It's not like they told me, but they responded so well to the dog and the presence of the dog that it gave comfort and also allowed some things. Like, I know my dog, so I was able to pay attention to those things. So if you want a therapy animal, a trained therapy animal, I highly suggest that you call Pulse for People. I will make sure that I drop that information in the link as well. So what should be a crisis plan? I do think that as a daycare provider, even though we're talking about physical abuse, you should also be taking a look at mental health as well. So, and you should have a crisis plan, both for mental health and for physical. So one of the things is if a child expresses a plan to harm himself or others. The other one is if a child expresses means or a plan. So one is like, I am going to take this rope and harm myself with this rope, or, and this is how I'm going to do that. The third is if a child informs you of psychosis, meaning they're saying to you, I'm hearing voices and they're telling me to do these things. That would be considered a psychiatric emergency. And you want to make sure you have a plan for that. So the next couple of slides, I'm going to tell you exactly how you do that. That's simply just sitting down. And if there is a psychiatric emergency and the child happens in your presence to have a psychiatric break, then you know exactly what to do. So this is really important. I don't know if you guys can kind of screenshot this, but we talked about a plan, but you want to make sure that your staff is well aware that whoever your admin is, that is trained to handle these things, that they do. Of course, if it's physical abuse, you know that you all are mandated court reporters, so you have to go call the Division of Family Services if you suspect abuse. Now, that doesn't mean that you can play I Spy and go, well, I'm going to go ahead and ask questions. That's not your job. Your job is, do you think there's abuse at home? If you think it, you call that number, the DFS number. I can see my face. I don't know if it's in the way of what you see. So I just moved it down a little bit. So that number to the DFS hotline is 1-302-425-7490. Again, you are mandated court reporter. So if something happens, a kid comes to your daycare, they have bruises, you suspect that there's abuse, you have to call. Here's the other one that you needed to look at to implement for your daycare plan, and that's for mental health. So this number right here, it's Delaware's helpline. It's 1-800-969-HELP, which basically is 4357. Again, that's 1-800-969-4357. Now, the great thing about this number, let's just say you had a child, they tell you that they hear voices. They tell you that the voices are, want them to hurt someone. What you can do is you call this number. They will ask you, did you get permission from the parents? So you might want to try to think about maybe talking to some of you work with lawyers, seeing how you can implement this into your packet that you hand out to your families when you are doing your yearly assessments for your families, or even when you have an initial client coming in and you're handing them that packet. So saying, yes, I give permission if my child has a psychiatric emergency, that we have the permission to call this mental health risk assessment. What that does is it takes that out of your hands and it places it immediately in the hands of a professional, and a person will come to your daycare, and if by chance it's necessary, they will do a mental health screening right on the spot. But if you had that something in writing, something in your child's file, it makes it easy, because what they're going to ask you is, did you get the parents' permission to call? You'll be able to say, yes, I did, because you'll be able to provide that paperwork that you would have, which should be a part of your plan. And that could be anything. If the child is like suicidal, if the child is homicidal, if the child is cutting, if you see a child and they have like all these cuts on them and you don't know what to do about it, this is a good number to call. Leave it up to the professionals. Let them make the assessment. It takes it off of you, and you can show what you did. And that would be a good thing to have. And also you make sure that the parents are contacted, because it's just, you treat that no different than it was something physical. You want to make sure that your parents are contacted and that you told them exactly, what you were able to do. These numbers, I'm going to try to move myself again, because I don't know if you're seeing directly my screen. So I'll move myself up here. No? Oh, we're good. Okay, Shanita's saying no. So pretty much, if you have private insurance, and this is something just a takeaway to give to your families. So if you have private insurance or Medicaid, any family can call 911 or a daycare provider and go to the nearest emergency room if there is a psychiatric crisis, or there's Rockford, Terry Center, or Meadowwood. However, if you have Medicaid, not that your services will lessen, it's actually, state of Delaware has a contract that they handle. So this is the same number that I gave you the last screen, and it's to our mobile response and stabilization service. So they would just call that number, and what happens is they start all the work ahead of time. So in the event that your child may need a crisis bed, for example, and a crisis bed would be if you're staying overnight in the facility, then they would be able to verify, insurance and get them what they need pretty quick. And also, you want to make sure that you follow the clinical recommendation. Oftentimes, providers or schools will call crisis and they will say, well, our recommendation is that this child needs to have services in an overnight setting. And parents will say, well, I don't want to do that because I don't want my child to pick up a bad behavior. Let's just say your child is suicidal. And they say, well, I don't want my child to go because I don't want them picking up bad behaviors. Well, I'm going to be very blunt, but dead children can't pick up behaviors. And I know that sounds like horrible, but it's a fact. Dead children cannot pick up a behavior. So what is worse? The fact that your child is, possibly could carry out something, and suicide rates in Delaware are high for children. So this is something that we need to really pay attention to, or actually just say, you know what, this is out of my milieu. I'm not, like we talked about slides ago, I don't know about this, but these people do, and they're recommending this. I would go for it, because they are the professionals. The other one I want to show you, and this is state of Delaware has really been pubbing this as well. It's like their baby, and that's their text DE to 741-741. It's a crisis hotline. So this is more so for your older kiddos that has their cell phones and they're having some crisis. It wouldn't be a bad idea, again, to have like a mental health sheet that you would hand out to your families that has this information on there. Not a bad idea. The new daycare that I'm at, they actually handed me something about cooking meals because I'm not that domesticated. So so if they could hand me something about cooking meals, then I could probably get something with mental health as well, right? Why not? And our kids go through so much, but it's really simple. What happens is when you text DE to 741-741, someone will start texting your child immediately. They'll start just, hey, what's going on? And they'll try to figure out what's up, and they'll try to get them the help that they need. So these things you definitely want to make sure that you have. Again, these numbers are very important. Dial 911. So, so let's just say you have a kid, they are going to hurt themselves. You do not have time to wait for mobile response and stabilization. Always, 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 always dial 911. Make sure the child is safe until they can get there, and make sure the other children are away from the child. So if the child is throwing things or no one gets hurt. So that is number one. Like, don't wait for mobile response and stabilization services. Don't wait for them if by chance this child is in imminent harm, meaning right now this child needs services. We're not waiting for them. We're calling 911. Let's just make sure that is clear. We are not waiting for them. We are dialing 911. We're getting that child safe, and we're moving the other children out of the way so we can handle the situation. And of course, you have the text DE to 741-741. So I'm going to open it up for questions, but before I do that, this is my contact information. So if any of you want to reach out to me directly, you can do that. I'm actually going to give you ladies my cell phone. That is the number to our answering service. So my cell phone number is 302-383-5011. And below this is our website. So if you have any questions, because I talk fast, I'm from Philly. Shanita told you I'm a Philly girl. We talk fast and we move fast. You can definitely reach out to me. And I want to thank you for your time, but I do want to open it up for questions.
And something else I had told everyone earlier was that if you have a question that you don't want to ask publicly, you can use the private ask a question feature. You would just on your chat box, you would just in the to field, you can just click Dawn's name to ask her directly. Or if you wanted to ask me to ask her. And I did open it up and I've been monitoring messages as well, just in case anybody had a sensitive situation and they wanted to ask a question that they didn't feel comfortable asking publicly. There are no stupid questions, only the ones that we're too afraid to ask, or at least that's what my daddy told me. He told me a lot of things.
I'm actually copying the link as well, so they have that video that they can look at it when they get a chance. So let me go back and put it in here. This is actually, ladies and gentlemen, I don't know who's in, but I'm going to drop this in here. And that is the link to YouTube that you can kind of copy that and at your leisure go back and look at that. I think there was something else. I'm just going to put my name in here in the chat and my phone number so you can reach me. That is another one. And I can't remember the other piece that I stated that I would put in the chat so that you have those resources. But if you guys think of anything, I see. Thank you, Ms. Hamilton. She said she has no questions, but thank you for the information. You are most welcome. Ms. Weaver, thank you. No problem. Yes, I see all of your, thank you so much. So if there's no questions, no questions?
I want to thank you again for being so ready, willing, and able to come talk to us in spite of everything, because everybody has so much stuff going on. I appreciate all the resources. I love dogs. I talk to my dog. I sometimes forget he's not a person. I see the effects that animals can have. And a lot of our childcare owners do have pets in the classroom. So if you are dealing with children like that, you might want to take that advice and check out Pulse for People. That would be extremely helpful. And you all have Dawn's contact information should any questions come up in the future. So thank you all so much for your attention. And
that's what I have to give. Hold on one second. Let me get that. I'm sorry, I just saw Ms. Hamilton. Let me get that for you. I knew it was something. I have mommy brain. I swear, since I had my son, I forget everything.
Yeah, that I have mommy brain too. Mine is 16 and still there.
I'm going to put it in the chat as well. So they are Paws for People. And they're located right in Delaware, actually right in Newark.
And a lot of people here are in various states. I see New York, I do see Pennsylvania, I see Texas. I'm not sure about some of the other states, but I'm sure there are similar organizations in your state. Yes. So if you call the Delaware number, if you can't find it with a Google search, Delaware may actually be able to give you the contact information for your state. And then I see Miss Teresa is saying something. Oh, she said, no questions. This is really something we should be aware of, even with toddlers. But we'll definitely look to see, she's going to look to see if they have one in her state as well.
And just also, I know that, and this was actually provided from to me from the last daycare, but I know that there are psychologists, at least I know there's one in Delaware specifically, that they actually work with daycares and try to work with the staff to, and they call it, so they call it not PCIT because that's parent-child interactive therapy. It's TCIT, so teacher-child interactive therapy. And what they do is they come in and they observe your daycare and how your employees are working with children, and they give them really helpful tips on how to engage them more than what they're already doing. So you can check in your prospective states if they have anything like that in your state. In terms of PALs, they are in Delaware, New Jersey, Pennsylvania. Yes, TCIT. Yes, and that's Teacher Child Interactive Therapy. It is an evidence-based therapy. So the way it works is kind of like PCIT. So those who know what PCIT is, that's Parent-Child Interactive Therapy. It's very extensive. It just involves the therapist watching the family to see how they work. Now, this type of therapy from, I've been trained, but I'm not certified to do that. What they do is they watch the engagement of the parent and the child and the teacher and the child. So the TCIT, the teacher child interactive therapy, they'll watch the interaction between the daycare worker and the children, and they would be able to provide some feedback in regards to how they can engage the child more. So the only reason why I didn't do it at the last daycare that I just left was because we already receiving services that are very close. And what I don't want to do as a clinician, you don't work with two clinicians at one time, because the theoretical base could be different, and you don't want to confuse the child or the family. But especially if you're in Delaware, I don't know exactly where you would go and get that, but I'm sure if you Google it, you could probably find how to get a hold of that. But it's amazing, especially if you're really truly trying to get your staff to engage more with kids, especially kids that cannot advocate for themselves and speak for themselves.
I have a question.
Yes, ma'am.
So it's always a touchy subject when you have to approach a parent or suggest that maybe your child needs some additional help. Can you offer us some tips on how you can approach the subject without offending anyone, but definitely alerting the parent that they may need some sort of help?
Yeah, that is a touchy one, because unfortunately in our society, mental health is still considered a taboo subject. I'm a therapist, so you telling me my kid might need therapy, I'm hearing it, but some parents might look at that as failure at parenting and may not be receptive to anything you have to say mental health. The way that I would approach it is more so from like a systems of care approach, if you will. And what I mean by that is just like, how do we wrap around your child to make sure that they have everything they need to be successful? How do we work with you collectively and as a team to get you to the next level? And they might go, well, what do you mean by that? Well, what are some things that you're seeing at home? Because I want to help you, not just here in this daycare, but I'm assuming that these things that you're seeing are also in the home. So what's happening in the home? And just kind of coming at it that direction, just say, well, what if I told you I had something that might help you understand your child, so forth and so on. And that might open the door, but you have to approach it very gingerly. But I think from a standpoint of like, I just want to help you, help me, help you. How can I wrap around you? I see that you're struggling. I don't know how you're doing that, Mom. Congratulations. Like you are doing it, like you're doing it. But, I would like to see this not be such a struggle for you. How can we help you? What can we do as a daycare facility to wrap around you and help you?
Thank you. I think that is super helpful. Another question that I would have is, what if I know mom has confided in me that the child has some things going on, and maybe the child is in therapy, but my staff members, maybe they're not as experienced, maybe they don't know how to deal with it, and I don't want to gossip, and tell them any more than they need to know. Are there programs or ways that you can even help work with some of the adults to help the adults help the children, short of doing reassignments?
Right. And I know, like, working at one point in a school setting, that was a big thing, because teachers would want to know, well, what's wrong with them? Why are you pulling out in the classroom? I want to know. And I would not tell them. And it would really make them upset, because they would say, well, we feel like we have a right to know. Little people are no different than us. Just make sure your staff is trauma informed. So it shouldn't matter what the situation is. Your staff should be empathetic enough. It doesn't matter. Just assume that there's something, and just be willing to work with them. But some some people might, tell you because they feel comfortable with you, but some parents may not. But just be trauma informed, just because, just make sure that your staff is empathetic just because. For example, we have children that might fall asleep inside of a classroom. And of course, that would anger a teacher. Why are you sleeping in my class? But they didn't realize that the night before they were out hustling because they have to make money for their family because that's what they have to do just to make sure their family is eating or make sure the lights are on. So it's not that the kid is just being disrespectful. I'm just going to, just fall asleep in your class. It's that I have this thing going on, I can't sleep, or my parents are, my dad is beating my mom, or my mom is beating my dad, and I cannot sleep. So just make sure no matter what, it shouldn't matter. You shouldn't have to know what's going on with the child. Just be trauma informed, and just think about it from when you have stuff. If you had a fight with your, whoever you're with, and you come into work, you don't want people asking you a bunch of questions, and you sure enough don't want to share it at a cooler. You just want them to just back up off me, give me the space that I need to do what I need to do. I shouldn't have to tell you. So just make sure that your daycare is trauma informed, no matter what. They shouldn't have to say, oh, well, this person is going through depression. This person just, it would help you, but you shouldn't have to know those things for you to be empathetic. If they manifest, then they will, but be trauma informed as best as you can. And I see something in the chat, even though a parent notices behavior, their doctors most times dismiss the parent's concerns. That's true, as something to wait and see versus addressing the concerns head on. Ms. Williams, I definitely agree with you. There's some providers that do that, medical providers that do that, but this is where the parents and the daycare, we have to be the champions and advocate for our children, because like I said, they can't tell us what's going on. So we have to advocate and not take, well, oh, whatever. No, I know my child. And if you think that your child needs something, you are your child's biggest advocate. Your children and your daycare, they're your babies from 9 to 5. You have to be your baby's biggest advocate. What do I need to do for my babies to be their advocate? And you said your granddaughter is special needs, and we went through that with her. Yeah. So my son, full disclosure, he is considered special needs as well. So he needs an occupational therapist and a speech and language pathologist. He also has a traveling childhood educator. So it's very clear the daycare workers kind of know that he does struggle in some areas. Bright is, I don't know what, extremely intelligent little boy, but he does have some developmental delay. So once we can get the language right, then, we're cooking with some gas. But, let's just say, I don't want to disclose because I don't want him earmarked from classroom to classroom to classroom to classroom, So you should just be trauma informed. My child is working with something and you're saying you're allowing him to come, these people to come in and to provide a service. Just be trauma informed. They shouldn't have to say anything. And, just think of HIPAA, you shouldn't have to say anything. You should just be. And I know that sounds like so silly, but it's true. But I think we live in a society where people just want to know. They're curious. They want to know. But, when you're talking to your staff, that's what you want to say. And if you put it in such a way, like if you had an argument with your spouse and you came in the next day, would you want to talk about it at a water cooler? Well, if I said, I can't let you in to eat your lunch until you told us what's going on with you, that's ridiculous. And little people have the same rights. And you said, plus it matters of gains of the child's trust. I agree. And let me tell you something, kids are smart. They are smart. They can tell if a teacher doesn't like them or a daycare provider does not like them. They can tell. My little one upstairs, he can tell if someone doesn't like him or if they do like him. He can tell. And he's 2, going on 3. So, they are very smart and they're not stupid. A lot of people think just because they're little people, they don't know, they know, and sometimes they're willing to just come out and tell you. But when they tell you things, if you're a mandated court reporter and it's something that's of a concern, you have to address it immediately. And if it's something that's mental health and, you're the advocate and the champion. So mom may not, or dad may not, or grandma, whoever the caregiver is, may not get it, but you're the champion for this child. How do you advocate for this child? And that's a hard one. I tell people all the time, it's my biggest thing. You can't work with children and not work with their parents. It's no different than taking a garment of clothing to a dry cleaner, taking it for them to clean it, bringing it home to the same place, the same dirty house. Your garment is going to need to be cleaned again, even if you didn't put it on. We gotta be able to make sure that our parents are understanding of that, and even be in a position to get them help too. What if they came to you and say, I need help, and this is too much for me, I need help? I'm going to put this in here as well. It's a link to Psychology Today. Psychology Today is also an online place where you can find therapists. You just put in your zip code, and no matter where you are in the United States, because I don't think it's overseas, but just United States, you can find a clinician for either an adult or a child in that place. And you can even specialize, or I'm sorry, not specialize, but you can even reduce your search and say something specific, like I need help with eating disorder, or I need help with this. And then, you should be able to find a therapist. Then you have Miss Williams said she's 14 now and has been in therapy since age 3 and doing well. And yes, and they sure can. Yes. Miss Williams, thank you so much. I really appreciate all of your comments. But here's the other thing too, speaking to Shania's point, if you have like handouts that you give your parents yearly of just like different things, like my new daycare, like I said, they handed me a packet. I'm not, Betty Crocker, at all. So, with that being said, there is an app that they put in my packet about how to come up with a menu for meals. Well, that's important to me because I just don't, you think I could do something like that, but that's just not my thing. I know what I'm good at, and that's not it. So, if you have something in your welcome packet for your families that has a sheet about mental health, then they can look at it on their own. They don't have to, in their privacy of their own homes, and they can access this information if they're reading it. That way, it's not, you're not putting them in an uncomfortable situation. They can do it at their own leisure. But if you get a chance, also look at that YouTube, because that's also how you care for a child in the midst of trauma.
Wow, well, thank you so much. This has been quite informative. I don't know about y'all, but I have some notes and some information that I'm going to share with some people. Hopefully that we can help some people. And if you come up with some questions after the fact that maybe you didn't think of right now, or maybe if you start reading or looking over those websites and you come back with additional questions, let us know. Well, not let me know, but if you let me know, I will let Dawn know. You don't want me to know. I will let Dawn know, and we can get some resources for some of these kids. It's just so much going on in the world today, and they need help. If the adults need help, they do too. Thank you so much. Thank y'all for taking out some time on your Friday night to come and listen to all of this. Thank you for taking time out again on your Friday night. We appreciate you, and everybody have a happy, healthy, safe weekend.